Hello, I am Dr. Rick Chatwell, board-certified rheumatologist at the Arthritis Center of Nebraska. One of my special interests is in gouty arthritis, a disease that leads to extremely painful attacks of joint inflammation and arthritis. I am pleased to have you join me as I discuss understanding the basics of gout. For centuries, gout has been inaccurately portrayed as the disease of kings, because gout has long been associated with the kind of overindulgence in food and wine that only the rich and powerful could afford. But the fact is, anyone can be affected by gout, and the risk factors are varied. Fortunately, it is possible to treat gout and to reduce its agonizing attacks by avoiding food triggers and taking advantage of the medication options available today. Gout is a painful, progressive, and potentially debilitating form of arthritis that has been recognized since ancient times. Gout attacks cause a sudden onset of severe joint pain that is often accompanied by other signs and symptoms of inflammation, including redness, swelling, and tenderness of the joint. The initial attack may begin in the middle of the night with extreme pain and inflammation reaching its peak within 12 hours. The initial attack generally resolves over a week and then disappears completely, even if untreated. Although an attack typically affects a single joint, most often in the cooler regions of the body, like the big toe for example, some people develop a few inflamed joints at the same time. Other joints commonly involved include the ankles, knees, and less commonly the hands and elbows. Gout can affect people differently. Some people have only one attack and never experience another. Other people, however, experience gradually progressive attacks, which can lead to joint damage. People who have had repeated attacks of gout over many years can develop tophaceous gout. This causes large numbers of uric acid crystals to collect in the tissues of the body, including the joints, bones, and cartilage. This collection of crystals causes a nodule or tophus to form. The tophus causes resorption and erosion of the bone and can potentially cause deformity. The presence of tophi near the knuckles or small joints of the fingers can be a distressing cosmetic problem. Tophi are not painful or tender. However, they may become inflamed and cause symptoms like those of an acute gouty attack. Tophaceous gout was more common in the past when the treatment of hyperuricemia was unavailable. People with gout are at an increased risk of developing kidney problems. Uric acid crystals can collect in the urinary tract and form stones. Rarely, uric acid crystals can collect in the kidney itself, causing inflammation and scar tissue, which can reduce kidney function. Treatments are now available to control most cases of gout, but diagnosing gout can be difficult, and the treatment plans often have to be tailored for each person. Gout is caused by elevated uric acid levels in the blood called hyperuricemia. Up to 2/3 of individuals with hyperuricemia never develop symptoms. It remains unclear why some people with hyperuricemia develop gout, while others do not. Gout occurs when excess uric acid, a normal waste product, accumulates in the body as crystals and deposits in the tissues and joints. This happens most frequently because the kidneys are unable to sufficiently remove uric acid from the body through the urine, or less commonly because uric acid production increases. Certain foods, such as meat, shellfish, and alcohol, may increase uric acid levels and lead to gout attacks. Some medications can also increase uric acid levels. Examples of such medications include low to moderate dose aspirin, diuretics or water pills, and immunosuppressive agents used in organ transplantation such as cyclosporin. With time, increased uric acid levels in the blood may lead to deposits of monosodium urate crystals in and around the joints. These crystals can attract white blood cells which create inflammation, leading to severe attacks of gout. Gout affects approximately 2% of people in the United States. Although gout can occur at any age, its onset occurs most frequently in men after age 30 and in women after menopause. Gout is strongly associated with obesity, hypertension, hyperlipidemia such as hypercholesterolemia, diabetes, and renal disease. Because of genetic factors, gout tends to run in some families. Several other kinds of arthritis can mimic gout, so proper diagnosis is essential. Gout is strongly suspected if a person has an acute attack of joint pain, followed by a period when there are no symptoms. It is important to confirm the diagnosis of gout to ensure that potentially harmful medications are not taken unnecessarily over a prolonged period of time. A correct diagnosis may depend on finding the characteristic monosodium urate crystals when performing a synovial fluid analysis from the fluid of an affected joint. Tophi, located just beneath the skin, can also be sampled with a needle to diagnose tophaceous gout. However, some people do not have uric acid crystals in their synovial fluid when symptoms are present. In this case, the clinical diagnosis is based upon a person's symptoms and their physical examination. It is important to note that uric acid levels in the blood can be misleading, as these may be temporarily normal or even low during attacks. Uric acid levels can often be elevated in people who do not have gout. The goal of treating flares of gouty arthritis is to reduce pain and inflammation quickly and safely, and then to prevent further attacks and joint damage. It may be necessary to use more than one drug to achieve this goal. Deciding which medication to use is based upon several factors, including the person's general health and medical history. Anti-inflammatory medications are the best treatment for acute gout attacks and are best started early in the course of the attack. Traditional treatment for acute gout has consisted of non-steroidal anti-inflammatory drugs, or NSAIDs, that work to reduce pain, swelling, and inflammation in the joints and tissues. NSAIDs, such as indomethacin and naproxen, have become the treatment choice for most acute attacks of gout. There is no evidence, however, that any one NSAID is better than the others. Although aspirin is an NSAID, it is not usually recommended for the treatment of gout because of its potential impact on uric acid levels in the blood. Some people are unable to take NSAIDs because of medical conditions such as peptic ulcer disease, impaired kidney function, or the use of blood thinners. NSAID medications are most effective in the treatment of gout when they are started as soon as possible before the attack is full-blown. Colchicine may be prescribed instead of a non-steroidal anti-inflammatory drug. Colchicine, unlike the non-steroidal anti-inflammatory drugs, does not increase the risk of ulcers, has no known interaction with anticoagulants, and in proper doses does not affect kidney function. However, colchicine can have significant gastrointestinal side effects, including abdominal cramps, nausea, vomiting, and diarrhea. For this reason, colchicine is generally reserved for patients who cannot tolerate non-steroidal anti-inflammatory drugs, or it is used at low doses as prophylactic therapy. Corticosteroids are the most effective anti-inflammatory agents. The most commonly used oral steroids include prednisone and methylprednisolone. Steroids may be used if non-steroidal anti-inflammatory drugs and colchicine cannot be used. They may be given orally, by intramuscular injection, or directly injected into the affected joint. Prophylactic therapy aims to prevent or reduce the occurrence of acute flares of gouty arthritis. Colchicine is usually recommended as prophylactic therapy. Colchicine, which is taken daily at a low dose to avoid gastrointestinal side effects, reduces the frequency of gout attacks, particularly while starting other medications that will ultimately lower uric acid levels. Prophylactic colchicine is a helpful bridge as a person progresses from an acute flare to preventive therapy. Preventive therapy includes medications and dietary changes that can be used long-term to lower uric acid levels and prevent the progression of gout. These medications do not relieve the pain and inflammation of an acute attack. Not everyone with gout will require preventive therapy. Those who have rare or mild attacks may be able to manage their gout by treating the acute attacks alone. On the other hand, people with sporadic gout flares that are unusually prolonged, painful, or disabling are often encouraged to take preventive therapy. Uric acid lowering medications lower uric acid levels by improving excretion or decreasing the production of uric acid. This therapy is usually started after a gout attack has resolved. People who take their medication regularly experience fewer attacks. At present, preventive therapy is continued indefinitely because there is no benefit to taking a break from this medication. Lowering uric acid levels is a process that can take weeks or months because rapidly lowering uric acid levels in the blood can cause acute flares of gout. Medications to lower uric acid should be started at a low dose and increased slowly until the blood uric acid level is reduced and maintained at a level where uric acid crystal formation is unlikely. Blood levels of uric acid are monitored periodically to ensure that the proper uric acid level is maintained. Once a commitment is made to use any agent to lower uric acid levels, therapy should be increased gradually until levels of uric acid are less than 6 milligrams per deciliter. This is a point at which crystals can be dissolved. Allopurinol works by preventing the formation of uric acid. It is the most commonly used drug for lowering uric acid levels in gout. It is the best medication for people who have gout and who need to have uric acid controlled by medication. Allopurinol can cause side effects including skin rash, fatigue, and stomach upset, although these problems occur in a relatively small percentage of patients. In rare cases, allopurinol can cause a severe allergic reaction. Probenecid is used to lower uric acid levels in the blood by increasing the amount of uric acid excreted into the urine by the kidneys. Probenecid is much less effective in people with kidney disease. Probenecid can cause side effects including rash, stomach upset, headaches, and kidney stone formation. Lifestyle changes and dietary modifications make it easier to manage this lifetime disease. In some patients, dietary modifications are helpful in reducing the frequency of gout attacks. Because obesity is a risk factor for gout, as well as for many other health conditions such as heart disease, diabetes, and high blood pressure, losing weight is an important goal. However, fad diets and fasting are not recommended. Dietary guidelines for patients with gout have changed over the years. The current recommendations include reducing the intake of red meat and seafood and reducing or eliminating the intake of alcohol. High fructose corn syrup products, as in some types of non-diet soda, can increase blood uric acid levels and are not recommended. Coffee and the spice curry may decrease the risk for gout. Vitamin C has a mild uric acid lowering effect and may be recommended as well. Changes in diet are often recommended along with medications, but the reduction in blood uric acid levels due to dietary change alone is modest, in the range of 15 to 20%, even with very strict diets. Gout can be controlled and even prevented if it is diagnosed correctly, appropriate medication is taken, and diet and lifestyle changes are followed. The treatment of gout can be complicated by coexisting medical conditions and other medications. No two patients are alike, and recommendations can vary from one person to another. As experts in the treatment of arthritis, rheumatologists evaluate patients to determine whether gout is the cause of their arthritis, to educate them about the role and proper use of medications, as well as other treatment measures, and act as a resource to primary care physicians. Thank you for your interest in learning more about gouty arthritis. Our team of Mayo Clinic trained and board certified rheumatologists at the Arthritis Center of Nebraska consider it a privilege to help people with arthritis and autoimmune diseases. We invite you to call 402-420-1212 for more information or to schedule an appointment. Thank you.